So this event is being put on by a few organizations, and let me just take a moment to introduce them. So first, Lifestyle is Medicine. Yeah, there we go. So Lifestyle is Medicine is a not-for-profit based in Toronto. We're a group of Seventh-day Adventist health professionals, and we try to put on lifestyle medicine community events to share the principles about lifestyle medicine to the community. So we hold events mainly in churches, like dinner with the doctor, other community clinical programs. So if you're interested in maybe having us come and do some programs with your church, please feel free to contact us. There's a link there. Our website is lifestylemed.org, and our email is info@lifestylemed.org. So please feel free to reach out to us. The other organization is Lifestyle is Medicine Institute, and basically our vision is to train every Seventh-day Adventist in lifestyle medicine to be soul-winning health missionaries. So if you are also interested in some of our programs, we run training in churches, and we also are going to run training as part of some lifestyle medicine immersion programs. So if you're interested in any of those, again, feel free to reach out to us. Info@lifestylemed.org. And finally, Pathways Lifestyle Medicine Clinics is a group of nutrition and lifestyle medicine clinics in Toronto. And we help patients reverse diabetes, high cholesterol, hypertension, other chronic diseases using evidence-based lifestyle medicine. So we operate out of 3 clinics that you see there on the slide. And if you're interested, again, feel free to reach out to us, pathways-to-wholeness.ca, and our email is on the screen there. So we have a really interesting topic. We've had lots of interest. We are talking about the recent COVID vaccine. As you all may know, vaccine was approved by Pfizer, approved for Pfizer and BioNTech, and just I think yesterday for Moderna. And you know, obviously as Seventh-day Adventists, we have many questions about vaccines. And I think there's been some sessions going around, but I don't think many have actually looked into the study itself. So in the New England Journal of Medicine, the actual study on the Pfizer vaccine was published. And so we want to actually look into that. What does the study actually say, and what it says about the vaccine? And then I just want to answer your questions and look at it from more of a lifestyle medicine perspective. So in terms of lifestyle for health, like, well, what does a vaccine mean? And so we just want to give you perspective from a science lens, also as Seventh-day Adventist health professionals. So we hope that this session will be helpful. And to do that, we have 2 doctors. Let me briefly introduce them. First, Dr. George Cho is a naturopathic doctor. He practices at Pathways Lifestyle Medicine Clinics, and he also works at Cleveland Clinic, Canada. So Dr. Cho will be taking us through this study in the New England Journal of Medicine. And then following him will be Dr. Wilmar Koo. He's a family physician practicing out of Curtis, I think near Oshawa. And Dr. Marku will be sharing his perspective as a Seventh-day Adventist medical doctor, and also I believe going through some of the history of vaccines within the Seventh-day Adventist Church. I believe also Dr. Marku, you'll be sharing about some Ellen White counsels on the vaccine. So I just really want to thank everyone for joining us. And usually we do these events for more of like a general public audience, but this one we've specifically targeted it to Seventh-day Adventists because we just want to really share with our brothers and sisters from an Adventist perspective. If you're not an Adventist, you're on this call, we really still want to welcome you. Thank you for joining us. So since this is mainly targeted towards Seventh-day Adventists, and we're mainly an Adventist group, we would like to start with a word of prayer. So if you don't mind, just bow your heads and join me. Let's pray, everyone. Eternal Father, thank you so much for bringing us here together. This is such an important topic, so relevant to our times. And we just pray, Lord, that you'll give us wisdom to navigate these sometimes difficult issues. Please be with Dr. Cho and Dr. Marku as they speak to us. Send your Holy Spirit, give us understanding so we can make best decisions according to your will, we pray. In Jesus' name, amen. All right, so first I'm going to turn it over to Dr. Cho. Thank you.
Good evening, everyone. Hope you're all doing well. First of all, Daniel, we're getting messages in the chat that we might have maxed out. So I don't know if that could be remedied in any way, but in any case, just letting you know.
Okay.
Yeah. Hello, everyone. I'm George, and I'll be talking about what is the vaccine and also the study. Okay, what does the actual study say about this Pfizer vaccine? Now, we can talk about a lot of different types of vaccines, but we're gonna focus solely on the Pfizer vaccine tonight. Okay. First, for myself and Dr. Marco, we don't have conflicts of interest to disclose to you. We're just doctors, and also, of course, this is for educational purposes only. So we don't know your health history. We encourage you to go speak with your healthcare provider. All right. Now, just a little bit about where I'm coming from. So, you know, I didn't focus too much on the vaccine until the Pfizer vaccine was approved. And so it started to get me interested, and people started asking me about what my thoughts were. Now, last week on Thursday, the actual study was published on the clinical trial for the vaccine. This is the study right here, the New England Journal of Medicine, a very prestigious medical journal. And this is the actual study here. So I fished this out and I actually took a look at the study. And basically, after reading the study, this is what motivated me to call my brother and say, you know, we need to do a webinar on this. And then we called Dr. Marku to ask if he would participate, because as I was reading the study, I realized that what people are often hearing in the media is often is not the whole picture. It's often skewed. On the other hand, those who have very serious concerns about vaccines in general, it seemed to me that they were also propagating certain viewpoints that could not be really substantiated either. And so what we want to do and what we're going to do tonight, actually look at the actual study, the actual data set, right? It's kind of like us as Adventists, right? We say, you know, you have to actually go back to the Bible, right? Don't take what so-and-so, whatever, like you have to actually go to the Bible. And so what we're gonna do, we're actually gonna look at the actual study and say, ask yourself, what does this study actually say about this vaccine? Okay, so this is what we're gonna do. But first, what is the vaccine? The vaccine is an mRNA vaccine. Okay, mRNA is a code, is a genetic code. Okay, it's surrounded by a lipid capsule. It's like a lipid capsule. All right. Now, what is mRNA? All right. mRNA is right here. So you have DNA, and this is your nucleus. You have DNA, and then DNA transcribes mRNA. mRNA leaves the nucleus. It goes into the cytoplasm, and then it gets transcribed and it makes proteins. Okay, so this is what mRNA does. All right, that's the function of mRNA. So the question is, what protein is this mRNA vaccine causing your body to produce? Right? Well, it's the spike protein. So some of you probably heard of the spike protein. So what is the spike protein? This is the SARS-CoV-2 virus, the virus that causes COVID-19. Okay. In your body, you have receptors called ACE2 receptors right here. Okay. The virus uses the spike protein to attach to the ACE receptor. When it does that, then it allows the virus to get into the cell. Okay, do you all see that? So the spike glycoprotein is the critical component that allows it to bind to ACE2, then get into the cells, all right? So the mRNA vaccine, okay, what it does is it produces this protein, okay? So why is that beneficial? Well, we'll get to that later. Now, what are the ingredients in this vaccine? So a lot of people have concerns about ingredients, okay? So first you have the mRNA. You got lipids that are forming the capsule, okay? And then you got other non-medicinal ingredients like such. This is it, okay? So basically a bunch of salts, some lipids, and the mRNA, all right? Interestingly, no preservatives, okay? No thimerosal and all that kind of stuff, all right? So in my view, quite simple, okay? It's also important to note you're not being injected with the virus. Okay, so this is also important to know. You are not being injected with the virus. You're being injected with the mRNA. I think that's another important thing to note as well. Okay, so what happens? They inject the vaccine into your shoulder. The vaccine gets into your cell. It does not go into your nucleus. So this is your DNA. It does not go in here. Okay, mRNA does not need to go in here. It can stay in here, the cytoplasm, okay? In the cytoplasm, it starts producing spike protein, okay? So the thing that binds onto the ACE receptor. When it does that, the spike protein then gets shipped off to the outside of the cell and starts expressing on the surface of the cell. Okay, so this is what happens. Okay, then hopefully your immune system will come and detect it and then eventually form antibodies, and immune memory cells and other adaptive immune cells will come and produce memory, so that next time when you face the actual virus, you have the antibodies to neutralize the spike protein. And also you hopefully have memories like T cells, for example, that'll go and kill the virus, killer T cells and so forth. Okay, so this is what the virus is doing. I mean, sorry, the vaccine. This is what the vaccine is meant to do. All right. So vaccine, body produces spike proteins, B cells produce antibodies. Then hopefully when you actually face the virus, it gets neutralized. And also T cells are formed to hopefully kill the virus. Okay, this is what this vaccine is supposed to do. Now, I want you to notice here that the heavy lifting is actually not done by the vaccine. It's actually done by your immune system. Did you all see that? The vaccine is actually a passive player. The main role is actually the main functions are done by actually your immune system. Okay, so keep that in mind. All right. So the big question then is it efficacious? So does it actually work? And is it safe? Okay, that is obviously the big question that people want to know. Okay, and to answer that, we turn to the actual study. All right, the actual study published in the New England Journal of Medicine last Thursday, I believe it was. Okay, so first, let's see whether it was safe. Okay, so what they did, about 18,500 in each group. One group got vaccinated, one group got the control. Okay, on day 21, they got the second dose. So they got dose number 1, day 1, dose number 2 on day 21. Okay, then they tracked for approximately an average of 2 months after the second dose. And they asked the question, were there any adverse events? Okay, so did anything bad happen? Did you get sick? Did anything bad happen? So that's what they're doing. Okay, so about 2 months follow-up after the second dose. Okay. Now, interestingly, they got a subset of the vaccine group called the reactogenicity subset. Okay, and for this group, they looked at local and systemic events and use of anti-fever meds within 7 days of getting the first dose and within 7 days of getting the second dose. Okay, so this is what they did to test the safety. Okay, and what did they find? Okay, so first, let's look at this group here. Okay, so this and this. Okay, what did they find? As you can see, pretty much most people had pain at the injection site, which shouldn't be very surprising, right? I mean, this is kind of expected. Okay, so whether you're kind of young to middle-aged and seniors. Generally, the group that got the vaccine had more pain at the injection site, as you can see here. There's some redness, some swelling, but very low percentages. Okay, so basically, pretty much within 7 days, the main thing is like pain at the injection site. Okay, nothing too serious. Okay. They also looked at kind of more systemic stuff, so like fever, fatigue, and headache, and muscle pain, and joint pain, and vomiting, and stuff like that. Okay, and as you can see, most, not most, but about half felt some fatigue. Okay, so the vaccine group felt more fatigue than the placebo group. Okay, there were some people who got headaches, muscle pain. Some people had to use anti-fever meds, right? But you can see here, generally, it's the percentages of side effects actually not too bad. So you see the chills, 35%, vomiting and diarrhea. There's some people who had vomiting and diarrhea, joint pain, some people had joint pain, okay? And most of these symptoms were actually not very severe, all right? So I think what we can safely say is that within 7 days, when you look at those outcomes, this vaccine is generally safe. So you might have heard on the news, there's very limited side effects. And if you actually look at the study, that actually seems to be being reported correctly, okay? Now, how about this group right here? Okay, so adverse events. Okay, so let's take a look at that, okay? 64 people in the vaccine group got what is called lymphadenopathy. Okay, so basically it's just like swelling in your lymph nodes. So, you have lymph nodes all over your body and your armpits and neck, places like that. And so there was some swelling there, okay? Only 6 people in the placebo group got lymphadenopathy, okay? Now, some of you might be thinking, oh man, this picture kind of looks scary, right? But to be honest, it's actually not too surprising that you get some lymphadenopathy because that's actually a sign that your immune system is kind of being activated, okay? So 64 versus 6, all right? Now, were there any serious adverse events? So I think that's something that really people who have concerns about vaccines, that's what they really want to know, right? Are there any serious adverse events, okay? So they reported 4 serious events, adverse events related to the vaccine. Okay, so shoulder injury related to the vaccine administration. So I'm not exactly sure what happened here. I don't know, maybe someone fell or something, but in any case, someone got a shoulder injury that was pretty serious. Lymphadenopathy on the right axilla. Okay, so I guess this was a more serious version. Arrhythmia, so one person got arrhythmia in their heart, and then paresthesia, that's basically like tingling sensations, so like abnormal sensations in your skin, okay? So there were 4 adverse events reported related to the vaccine, okay? So some of you might be looking at this, be like, holy smokes, like arrhythmia, I don't want to get arrhythmia, and like, I don't want weird sensations in my leg, but you have to understand that represents less than 1% of the whole group being studied. Okay, it's like 0.018%, something like that, okay? So pretty much the risk of adverse events seems to be very, very low, okay? These are the facts, all right? How about deaths, all right? Were there any deaths related to the vaccine, okay? So there were some people who died. Okay, so in the vaccine group, 1 person died of atherosclerosis, that's basically clogging the arteries, and then 1 person got cardiac arrest. 4 people in the placebo group died during the study, heart attack, stroke, and 2 of them were unknown. Okay, but none of these were reported to be related to the actual vaccine. And to be honest, I have no reason to doubt that these things were caused by the vaccine. Okay, so in conclusion, as far as I can gather from the study, that local symptoms within 7 days seem to be, it seems to be quite safe. And adverse events within 2 months of the study, it seems to be, it's pretty, the risks seem quite low, okay? So then, was it 100% totally safe? So it's totally safe, right? Well, this is where there needs to be some nuance, because if you look in the news, pretty much they're saying like, it's totally safe, 100% safe. If you don't believe that, then you're kind of out to lunch, right? You're a loony, okay? But actually look at the study itself. So if you go into New England Journal of Medicine, they actually published a research summary of the study. And this is what they say in that summary. Further study is required to understand the following: safety and efficacy beyond 2 months, and in groups not included in the trial, so children, pregnant women, immunocompromised persons. So as we noted, they looked at safety and efficacy 2 months after the second dose. So basically what they're saying is they're being very honest. They're saying we need to know the safety beyond 2 months, we need more study. So I believe that the accurate way to really portray the safety of this vaccine is to say within 2 months after the second dose, really your risk of adverse events and illness, it seems very low. Okay, I think this is a fact that really you can't deny. But it also has to be stated that but beyond 2 months, even the study itself says that they still need more study. And luckily enough for us, they are continuing to monitor these people. So hopefully with time, we will see more data come out, okay? So let's just pause and just kind of think about this. So, and on the one hand, we have certain individuals or certain voices which are saying this vaccine is not safe. And I believe that this is a little bit misleading, to be honest, because as far as the study showed, that there is a reasonable level of safety, at least within 2 months. So to categorically just say this vaccine is not safe, I believe is actually a little bit misleading. And in fact, when it comes to the Pfizer vaccine, really, there's no evidence that this is actually not safe. Does that make sense? Okay. On the other hand, the other voice is saying, this is totally safe. Like, like no doubt, like this is safe. Don't even question it, kind of thing. I believe that's also misleading as well, because the study was cut off about 2 months, average follow-up of 2 months after the second dose, right? So I believe it's a little bit misleading also to say, like this is totally safe. Don't even question the safety. Okay. Now, some people will say, studies have shown that if a vaccine doesn't elicit negative adverse events within 2 months, that really is relatively safe. Okay, and fine. I think you could perhaps make that assumption, but just to be fair, though, the study authors themselves say, we need more study beyond 2 months. Okay, so personally, I think that for those who have very strong concerns about vaccines in general, this study actually may not really satisfy them. On the other hand, if you are very concerned about vaccines in general, we have to make sure that we don't overstate our case either, okay? I hope that makes sense to everyone here. Now, having said that, I just want to just make one point. I come to this assuming that all of you, my brothers and sisters, have good intentions. So those who are pro-vaccine and those who are against vaccines, that all of us as Adventists, we have a common understanding that our bodies are temples. And I believe that people have very strong opinions because we all want to do what's best for the body temple. So those who are pro-vaccine, they want to do it because they want to keep themselves healthy. And also those who are against vaccines, I believe they're motivated by the same thing as well. So I think in this debate, it's good to acknowledge that each other, we all come from a good place, a good motivation. Okay. Now, the next thing is, does it work? All right, does it work? I think this is also a place where there needs to be a little bit more nuance. Okay, so you've all heard that this is 95% efficacious, and they get that from this year. Okay, so when they looked at the cases of COVID-19, they found 8 of people who got vaccinated got symptoms. Okay, versus 162 that did not get vaccinated. So you see 8 versus 162. That's a difference. That's a 95% pretty much difference. And so therefore it's 95% efficacious, all right? But is there more to the story than that? If it was just this, then I think we could say, wow, this is quite impressive. Okay, so whether you're both sides of the thing, you have to really admit that this is quite impressive, okay? But is there more to the story? I think there is, okay? So when people hear 95% efficacious, what people are assuming then is that this vaccine will help prevent infections, decrease symptoms, decrease severity, decrease transmission, and was shown to save lives. That is the automatic assumption that people are going to make. But when you actually look at the actual study, that is not the assumption that we can make, all right? So let's take a look, all right? What were the outcome measures? What were they actually looking at? They're looking at two major outcome measures, all right? Symptomatic COVID-19. So this is not like you got the virus. This is you got the virus and you're starting to elicit symptoms. And then you got tested positive. This is what this is looking at. And then the other thing they're looking at is severe COVID-19. Okay, so did you end up in the ICU? Things like that. Okay, so symptoms and severe. This is the two things that they're looking at. Okay, so what did they find? Okay, 18,000, almost 19,000 each group. Dose number one. After dose number one, 39 that got vaccinated got COVID. 82 got from the placebo group got COVID. Okay, so that's about a 50% efficacy. After dose number two, this is where the major divide happens. 8 versus 162. Okay, so they stopped it there and they said, okay, this is 95% efficacious because 8 versus 162, that's a pretty big difference. Okay. Now, how about severe COVID? Because really, you know, most of us can deal with a little bit of symptoms, but we want to know, like, you know, am I going to die? You know, am I going to end up in the ICU? Right? That's like really what matters, right? So what did they find? After dose number one, 4 in the placebo group got severe COVID, 0 in the vaccine group. After dose number 2, within 7 days, 0 versus 1, and then one person got severe COVID in the vaccine group versus 4. Okay, right off the bat, you could tell that the vaccine group did a little bit better, but to be honest, it's a little bit better, right? So I mean, these numbers are not huge if you compare to the total number of actual people in the study. Okay, so let's take a and before we do that, let's look at deaths. So how about deaths? How many people died in each group due to COVID-19? So in the vaccine group, 0 people died, which is good news. But lo and behold, in the placebo group, 0 people died. So no COVID-19 associated deaths were observed. That's a direct quotation from the study. So nobody in either group died from COVID-19. Okay. So how many people got symptoms and then tested positive? 47, 244, representing about 0.25% of the total, 1.3% of the placebo. Okay. Severe COVID, 1 versus 9. Okay, but 2% of the symptomatic cases, 3% of the symptomatic cases. And then like very low percentage compared to the total group. Then death, 0, 0. Okay, so I just want you to just kind of digest those numbers for a little bit. Okay. So the vast majority in both groups either didn't get infected or they got it, but the virus did not affect them enough for them to even seek any help. Okay, so that is the fact. All right. So what are my conclusions then for you? Before I hand it off to Dr. Marcoux here. So there are a few things that really matter, okay? Infection, transmission, getting sick, getting severely sick, and then dying, right? I think we would all agree this is kind of like what matters, right? And what we can say from this study is that it helped, it could lower your risk of getting symptoms, and it could also lower your risk of getting severe COVID. I think this is the conclusion that we can draw from this study. No one died, and they did not really look at infection and also transmission. Okay? So if you take the Pfizer vaccine, what the study shows right now is that it may help lower the risk of getting symptoms and severe COVID. All right, this is what the study shows. Now, some people might say, well, if the study went longer, then more people would have died and so forth. Okay, that is totally plausible, but we have to stay within the bounds of the study. And this is what the study showed, okay? And just to, it's not just me. I mean, if you look at the research summary from the study itself, this is what they say. They need more study to determine whether the vaccine protects against asymptomatic infection and transmission to unvaccinated persons. So right there, okay? So let's kind of bring it home. So some people are saying this vaccine is not effective. So there's people who are like, I guess, anti-vaccine or whatever, and they're saying this vaccine is not effective. That's actually misleading. It has been shown to be effective, okay, but in certain areas, not in all. On the other hand, if you look in the news, it makes it sound like, this study shows this vaccine will limit transmission to others. The study shows this vaccine will protect me from getting the virus. The study shows this vaccine saved lives. That's not true, okay? Nobody died, and they didn't look at transmission, and they didn't look at like whether the virus actually got into like infection. So I think we have to be very nuanced when we actually when we think about this this vaccine here, okay? And just in case if you don't believe me, maybe you'll believe Dr. Fauci. So just not too long, on December 14th, Dr. Fauci was interviewed by Dr. Bachner. This Dr. Bachner is the editor-in-chief of JAMA, and he was basically talking about this study. And this is what Dr. Fauci says. Okay, this is directly from his own words. Okay, it's really simple. The primary endpoint upon which 95% efficacy was determined was based on the prevention of clinically recognizable disease, not asymptomatic, not infection. This is from Fauci himself, okay? The secondary endpoint was protection against severe disease requiring hospital intervention, all right? So a typical scenario could be that someone is protected against infection and against clinically recognizable disease, but there's also a likely scenario that there is someone who is protected against clinically recognizable disease, but still have replication competent virus in their nasal pharynx. Hence, by definition, they are infected. So basically what he's saying is, you might have got it infected, but you won't get clinically recognizable disease, but you're technically still infected, okay? The question is, we don't know yet. So we don't know, okay? Hopefully data in a longer term follow-up and subsequent trials will determine whether or not you have a significant inhibition of actual infection. He ends off, the other thing that's a little bit more complicated is that it is conceivable that you could be protected against clinically recognizable disease. You could, however, get infected, but the level of immune response that protected you from clinically recognizable disease would be enough to lower the titer of the virus in your nasopharynx such that you would not be infective. So you could be infected, but not have enough virus in your nasopharynx to transmit it. So we don't know the answer to those last two questions. So when it comes to being infected and being infective, infecting it to others, he says we don't know the answer yet. So if Dr. Fauci doesn't know, then probably most of us doesn't know, okay? So does it protect against infection? And if you are infected, does it render the viral load so low that you are not transmitted to anyone? He said, we don't know, okay? So the conclusion is that I believe that this vaccine has been shown to be efficacious to lower the risk of getting symptoms and perhaps lowering the risk of getting severe COVID. It doesn't say much about transmission, infection, and no one died in either group. Okay, that is what the study showed, all right? Now, I want to just end off very, very quickly here. Are there lessons that we can learn from prior vaccines? And as Seventh-day Adventists, is there any relationship with our health message? Okay, and I think there is. So this is Dr. Pollan. He's the head of Mayo Clinic Vaccine Research Group. He by no means anti-vax. This guy is just 100% pro-vaccination. But look what he says here. Vaccines are like seatbelts or airbags in cars. Maximum protection against injury or death occurs when they are used properly and in the right setting, but they are no guarantee of absolute protection and safety. So vaccines are not guaranteed of absolute protection and safety. Optimal vaccine immunogenicity occurs when the host is healthy with highly functioning innate adaptive humoral and cellular immune systems intact. Don't miss that. He's saying for a vaccine to really work optimally, you need a healthy immune system. Okay, this is really important. Diabetes, obesity, these can render the vaccine and make a insufficient or absent immune response to the vaccines. Okay, and these pretty much say the same thing. Okay, among elderly, if you have a weak immune system, it could render vaccines, it might make them less effective or not effective at all. So why is that the case? Well, take a look. So pretend this is a vaccine, okay? This is like a attenuated, weakened virus, let's say, okay? B cells activate to form antibodies. Okay, look at this. This whole thing needs to happen. In fact, this is overly simplified, okay? Also, T cells need to be formed as well. So you got this whole cascade of events that happens to form T cells, killer T cells, memory T cells, whatever, helper T cells, okay? And again, this is overly simplified. There's a whole complex dance that happens in the immune system in response to a vaccine. So we have to think here, who is the main player when it comes to this whole thing? It's not the vaccine, it's the immune system. Do you all see that? The vaccine is very passive. The immune system is what's active, all right? So vaccine relies completely on the human immune system. In fact, the immune system is the main, primary, and critical player, okay? Vaccine does not replace the immune system. It needs the immune system. I think people, we kind of understand that, but I think sometimes we really don't really let it sink in, okay? So as much as a weak immune system could benefit potentially from a vaccine also needs a strong immune system. You understand? So as much as a weak immune system may benefit from a vaccine may be rendered weak by weakened immune system. It's not just one way, it's both ways. But right now, my concern is that when you look in the media, it sounds like it's only one way, that the vaccine is just something that's like this magic thing that's gonna make everyone's immune systems get better or something like that. No, it goes both ways. And we know this from previous studies on vaccines. Okay, so this is where our health message comes in. Where eating properly, exercising, sleeping well, hydrotherapy, rest, having good social connections, trusting God, these things help optimize our immune system and therefore will help whether we need a vaccine or not, it's going to help. Okay, so I think this is really important and cannot be missed. Okay, I was going to talk about exercise here, but I'm going to ship this off to Dr. Marcoux, but exercise is critically important. So I just want to end off here by saying this. You know, in medicine, we have something called primary therapy, and then we have like secondary or adjuvant therapy. And basically what that means, like primary is like the main thing. And like adjuvant or secondary or adjunct is kind of like an add-on, right? So this is a language that you use. And right now, the way that people are talking, it seems like the vaccine is the primary and like everything else is just secondary, right? Like, and this is like in medicine in general, this is the way we see it. You know, medicines are the primary thing, and yeah, eating healthy and exercise, you know, that's kind of like you just kind of tack that on, you know. But it's the medicine that's really the most important thing, you know. But I want to submit to you that eating healthy, living healthy is actually primary medicine, and that a vaccine is actually secondary or adjunct or adjuvant. Okay, I know this might be a little bit of a bold statement to make, but I firmly believe this. And that if you want to get a vaccine and you're not taking care of your health, may I suggest to you that your priorities are misplaced. Okay, I want to encourage all of us here to, it's not either or. Okay, I want to make sure I'm clear. I'm not saying it's either or. I'm saying that it's definitely this. Okay, definitely healthy living is primary. Okay, and whether you decide to get vaccine or not, just understand that this is secondary medicine. Okay, our health message is primary. This is an adjunct, an adjuvant. All right. So this is what I'll leave you with, just a thought to think about, and then I'll turn to Dr. Marcoux, and we look forward to kind of answering some of your questions here. But I just want to encourage everyone to just have a kind of go back and actually read the study for yourself. And as you talk about the virus with others, just make sure, just be aware of some of these nuances, okay? And with that, I'll hand over to Dr. Marcoux.
Thank you, Doctor. Yeah, Dr. Marcoux, you there?
Yes, we're here. I just want to thank Lifestyle Medicine for having me on, and again, welcome to everybody. I'm going to take a slightly different slant. I appreciate Dr. Cho's efforts to bring us up to speed on the Pfizer vaccine. My role tonight is to kind of take us through, it's not like Adventists haven't been discussing this before. Every time there's a pandemic and Adventists discuss vaccination and they're open about it with each other. And so in my research, I want to take us back to the Health Reformer. This was the first Adventist health magazine. And the editor, of course, were the physicians of the Health Institute, the forerunner of the Battle Creek Sanitarium, begun following the health vision that Ellen White had in the 1860s. In the 1870s, in 1873, there was a large pandemic of smallpox going on in London. And at that point in time, the authorities were requiring vaccinations. And the editors, just to give you a context, the editors of the Health Reformer, now, one of those editors was James White. Both James and Ellen White were contributors to the Health Reformer. And it was very clear in 1873 that the editors or the writer of the article that I was reviewing was clearly anti-vaccination. And it's fascinating, though, that by 1876, so 3 years later, now the pandemic is still smallpox, so obviously it is a different context, but they were more articulating the official position, in a sense, of the church at that time. And I would like to share it because I think it actually mirrors the aspects of what Dr. Cho has already shared with us. So they gave a position on vaccines in the 1876 issue of the Health Reformer, and I would like to go over the 9 positions that they state. And then I'm going to share the present position of the General Conference and the Health Ministry Department. And then I want to take us back to Ellen White. Number one, this is 3 years after they were clearly against vaccine. Number one, vaccination is a protective against smallpox. So they obviously had changed somewhat of their position. 2, now this is interesting, hygienic living is as good a protective. So that's exactly what we're saying today, is that lifestyle, in their position, is that it's just as good. Number 3, vaccination, as usually practiced, may become the means of communicating other diseases. Number 4, vaccination is not a certain protective against smallpox. Number 5, hygienic living will not only fortify a person against the disease, but it will enable him to pass through it safely if he contracts it. Number 6, vaccination will itself sometimes occasion death. As the best, it is an expenditure of vitality and a poisoning of the system unpleasant to think of. Number 7, vaccination is unnecessary for those who are protected by hygienic living, and such ought not to be compelled to submit to it. So this is a matter of conscience in here. But the point is that hygienic living may be enough. And number 8, now this is fascinating. Number 8, since the great masses of the people of our large cities can never be made to conform to the rules of right living, it may be that vaccination is for them the best expenditure. And number 9, if vaccination must be practiced, only the pure virus should be employed so that all risk of contracting other diseases may be avoided. I mean, this is 1870s. And I think that there's principles in here that certainly we can sort of take to heart. Certainly, their word for lifestyle of medicine, of course, is hygienic living, but it's the same principles. So so as a people, we have held this kind of position for over 150 years. All right, I just want to quickly go fast forward here now to our present position of the General Conference and Health Ministries Department. And we actually have, as a people, an official statement on vaccinations. And I think it's fascinating as well to just quickly review it. So this is a very summation, okay? You can read the full report by just Googling it. Okay, so this is the official Adventist Church statement on vaccines. It says, it encourages responsible immunization and has no faith-based reason to discourage believers from participating in immunization programs. They go on to state, the Seventh-day Adventist Church places strong emphasis on health and well-being. The Adventist health emphasis is based on biblical revelation, the inspired writings of E.G. White, and on peer-reviewed scientific literature. As such, we encourage responsible immunization and have no religious or faith-based reason not to encourage, or you could also say to discourage, our adherents to responsibly participate in protective and preventative immunization programs. We value the health and safety of the population, which includes the maintenance of herd immunity. And that's a whole discussion on itself, if vaccines actually contribute to herd immunity or not. This is also very important. We are not the conscience of the individual church member and recognize individual choice. So that's the sort of the basis, okay? These are exercised by the individual. The choice not to be immunized is not and should not be seen as the dogma nor the doctrine of the Seventh-day Adventist Church. So anyways, that's their statement, and I don't want to put any more into it. Now, what about Ellen White? There's a fascinating letter. I'm just going to find it here. Okay, this is a letter from Willie White. Now, Willie White is the son of Ellen White, who was her travel companion. An angel told Ellen White that Willie was given to her to be that very thing, a support and her travel companion after James died. He was kind of always the level-headed sort of administrator throughout that time period, in a sense. Anyways, this is written to Dr. L.J. Kellogg, Loma Linda, California, and the date is February the 5th, 1924. And this is the letter. I'll just read it. It says here, Dear Brother Kellogg, I hold in my hand your letter of January the 20th, asking if I can tell you what the attitude was of Mrs. E.G. White towards vaccination. She regarded it as a perplexing question. I do not remember of her ever saying or writing that she had special instruction regarding vaccination. In my earlier days, she spoke of it as something dangerous and related my own experience. She said that as a child, I was perfectly healthy until I was vaccinated, and by that, my health was much impaired. Mother listened attentively to the argument that the methods of vaccination had been improved. And when in our travels we were brought to a large city where smallpox was raging and the matter was discussed as to whether or not that I and my associates should be vaccinated, she offered no objection. And in view of the argument of physicians that it was not only for our own safety, but for the safety of others, I and my associates were vaccinated. Yours in haste, W.C. White. Now, it doesn't say here that Ellen White got vaccinated, but it does say that Willie Wright and all the associates, that there was no objection from her part and they got vaccinated. So you get from this, in some ways, that she was quite, she recognized the dangers of vaccines, but she had no clear direction from God on it. So again, I think that in my own experience, this almost becomes a matter of conscience. And we are coming into this webinar almost assuming that pretty much everybody on this webinar has already pretty much made up their mind on their position, pro and con, vaccination in general, and probably most likely COVID in particular. But as you can, our emphasis tonight is, and you bring it up, it comes up in the 1876 a statement of the church, that the lifestyle, the hygienic living is really the most important point. And like Dr. Cho already has emphasized, sleep, absolutely crucial, has been shown to be protective for contracting viral infections. And sleep deprivation increases markedly your likelihood of getting sick. Also, outdoor living, or in a sense, the pine and the box and the fir, the aromas, the eucalyptus oils, things like that, have also clearly been shown to boost the innate immune system. A diet, again, if you're eating a lot of sugar, don't expect your macrophages to be moving very fast. I mean, they've actually shown that they're actually paralyzed with small amounts of sugar. Likewise, as a people, we have been encouraged to learn the simple methods to maximize our innate immune system, not the acquired immune system, but the innate one, the one that's going to protect us right off the bat. And as a church, we have always encouraged the rational use of water in hydrotherapy. And again, there's been study after study proving the benefits of hot and cold water, hot applications followed by cold, to the periphery of the skin to help blood flow, because that's really where our protection occurs. Sunshine, and this is where I want to get into just vitamin D just quickly. Dr. Wes Youngberg gives an excellent discussion of vitamin D and COVID in an audioverse presentation that he does. And I think Dan's going to put it into the chat box for those that are interested in following up with that. But it's clear there's some huge studies showing benefits of vitamin D out of Spain, where people coming into hospital with COVID, they split them into getting large dose vitamin D and no vitamin D. All the other treatments were the same, and the death fatality rate in the no vitamin D group was significant. I think it was over 5% of those admitted died. And in the vitamin D group, 0% died. So vitamin D has been shown to not only help the biofilms in the body so that that spike protein cannot actually attach to your membranes in your gut or your nose or your mouth or your eyes. It also slows down the viral replication phase, that first phase. Likewise, during the cytokine storm, the inflammatory phase, vitamin D has also helped to decrease the ability of the virus the inflammation to get out of hand. Now, just to go over some doses quickly, I think the single most thing that we can encourage our loved ones and ourselves to do is to make sure we are getting enough vitamin D. Now, up in the Northern Hemisphere is unlikely. I never offer vitamin D testing because everybody's low. But if you want to ensure that you're getting adequate amounts, I encourage you to pay the few dollars to get your vitamin D levels. Now, the recommendations for children are 2,000 units per day. Healthy adults under 65, 4,000 to 5,000 units per day. And over 65, anybody with diabetes or other health concerns, 10,000 units per day. Now, to get up, you don't want to stay in the low normal. You actually need to be up into the higher levels of normal in the range on the lab tests. So the drops are much quicker absorbed. So if you've been taking it already, then you're already up there, because it takes a number of weeks to get your levels up. But start with the drops, because that will increase your ability to get your levels up. And it's 10,000. Now, if you were to come down with respiratory symptoms or COVID, then the recommendation is to take 50,000 units daily for 3 days and then go back down to the 10,000 units. And that has been shown to really slow down and terminate significantly that first phase of viral replication, so that you never get into the inflammatory part. So maybe we're kind of maybe we should put it back to Daniel. I don't think I have anything more to say, but again, the last point is that our lifestyle is, maybe I'll end up this way. Masks are not 100% effective to stop us from COVID. Social distancing is not 100% effective to stop us from getting COVID. Vaccinations are not 100% effective from stopping us from getting COVID. But our innate immune systems, if healthy, and God's blessing, can stop COVID. I'll give it back to Dan.
All right. Thank you, Dr. Marcoux and Dr. Cho, for your presentation comments. I really thank you for the emphasis on lifestyle, which I think is, as you mentioned, getting lost a little bit in the conversation. So we are approaching 8:30. So what we're proposing is that we'll take maybe 15 minutes for questions. That'll take us to around 8:45. If you all have other commitments this evening, please feel free to leave. But if you would like to stay for the questions, that'd be awesome. We have lots of questions coming in. Thank you so much. We'll try to get through them as quickly as possible. So I'm going to ask Dr. Cho and Dr. Marcoux to just keep your questions as brief as possible. So let's just kind of try to go through them rapid fire here, and I'll try to summarize some questions as well. So the first one, in the UK, there's been news that there's a new strain coming out of the coronavirus. So Dr. Marcoux, what are your thoughts on current vaccine and new strains?
Right. So they did the genetic sequencing of the Wuhan virus And they know that not much of that genetic sequencing is still exactly the same. So it's clearly a situation, just like influenza is that this will seem to be an annual event in terms of a vaccination kind of thing. Yeah.
Okay. Thank you, Dr. Marku. Dr. Cho, I want to throw this to you. There's been several questions about the ingredients in the vaccine. Can you kind of just go over briefly again, what are components of the vaccine?
There's the lipids that are coating the where it's encapsulating the RNA. That's helping the vaccine to get into the cells. And also there's things, the other ingredients that you see there, they're used to stabilize the vaccine. Okay, so the salts in the water and things like that. Okay. So yeah, I'm not a biochemist. I'm not too sure about all the specifics, but that's my understanding what the purpose of those things are. Yeah.
Okay.
Yeah. I have a question. Did anywhere in the study, did it show where they made the mRNA? Like, where did that particularly come from? What cells produced the mRNA? Did it share anything about that, George?
I don't think they mentioned in the study, but my understanding is that it's lab made, so it's made in the lab. It's like synthetically. I'm not sure where they get all the other stuff from, though. Yeah. But one thing for sure,
synthetic or cellular? I mean that would be interesting to know.
Yeah, it wasn't though produced like from fetal cells and stuff like that. I know people have like ethical concerns about that kind of stuff. This was not from fetal and all that. Yeah.
Okay. There was a question about that, so thank you. Another question, is there, so this question is about, is the possibility that the mRNA injected into the cell could have adverse impacts such as overproduction of spike protein? Could the body keep producing these proteins endlessly, for example? Impact on health?
My understanding is that that RNA, once it's not very stable, so the body clears RNA very quickly. So I don't think it's going to just be there and just keep on endlessly producing spike proteins for infinitely, right? RNA is actually very unstable. So I don't think the risk of that happening is very high.
That's why the vaccine centers are only hospitals, because it has to be at like 180 degrees minus centigrade, you know, to keep it viable. So like you say, it's very fragile.
Yes. Yeah. So Dr. Cho, I'm going to just throw this one to you, and I think basically just kind of reiterating a point that you have made. So how do you know it's effective? It's only been tested for a short time. How can anyone know it's safe, say 2, 5, or 10 years in the future? I think you talked to that. You don't really know, right, based on the study.
Exactly. So what I'm saying by effective is when we say that when we say something is effective, we have to look at what the study length and what they exactly measured. So what I'm saying is that within 2 months of the second dose of the vaccine, that it seems to be efficacious in lowering the risk of you getting symptoms if you get infected and from progressing to severe COVID within that 2-month time frame after the second dose. That's what I'm saying. And that's the boundaries of the study. You can't go beyond that. So in fact, there are people who are saying, yeah, like how long will the immune memory last? 6 months, 5 months, 8 months? We don't know. Now, there was a paper released just recently where they said that when the body encounters the SARS-CoV-2 virus, that they looked after, like, I think it was 8 or 9 months after, and the memory was still there. So this is not from the vaccine, but just like from people who encountered the virus. So it seems like the memory is quite long, at least 8, 9 months. So hopefully the vaccine will also work that way too, but we don't know because the study was cut off after approximately 2 months after the second dose, as far as I could understand from the study. So So yes, is it effective beyond that? Well, we don't know, right? But we can say though, we cannot say that it's not effective, period. Because the studies did show that there was some effectiveness in doing something, and we have to at least acknowledge that, while also acknowledging that there are some questions that still need to be answered. So I'm encouraging everyone to kind of be nuanced as you talk about this. Don't make blanket statements. This is not effective or it's totally effective for everything. You have to be very, very kind of nuanced from stay within the parameters of the study.
Okay. Thank you. Dr. Cho, just quickly, who conducted the study?
I believe it's Pfizer. Pfizer and BioNTech. Yeah.
Yes, right. Okay. Yeah. So there's a question here about the maybe Dr. Marcoux. I'll throw this one too from CS. Say the vaccine has been authorized for emergency use, right? Emergency use authorization, the EUA. So how can they actually say it's safe since they're essentially admitting that there's not enough data? So do you think it's overblown when they say safe?
Yeah, I can understand the predicament that Health Canada was in because the government had already purchased Moderna's vaccine before it was even authorized by Health Canada. So absolutely, the timelines were very short, but at the same time, there was a ton of money thrown at this, and man is pretty resourceful when he has lots of cash, and so whether it was enough time, I mean, how do we answer that? I mean,
yes, I guess the point of the presentation today is that we don't know past for the long term, right? But I guess because it's such an emergency, people are just fast tracking. Who knows?
It was definitely fast tracked. Yes, for sure.
Yeah, for sure.
Because of the concerns, that is by the government. It was a political decision, obviously.
Yes, indeed. Okay. What is the usual time for a vaccine study?
So my understanding is for this trial, they're gonna study these people and follow them up for at least 2 years. So that's my understanding. Now, I've heard, and Dr. Marcoux can probably know a little bit better than me, but I heard that there some vaccines take up to 10 years, 9 years to come out. But this one's clearly they're doing it a little bit faster, but they are tracking these people for 2 years. And so hopefully we'll start getting more data about the safety of this vaccine. So luckily for most of us here, we're probably not going to even get the vaccine anyways until we won't even get access to it until later, so we can kind of watch and see. So yeah, so they're studying, I think, following for 2 years, these folks.
Okay. Question about so if a person has severe comorbidities or and therefore a compromised immune system, will the mRNA vaccine be ineffective for them? Did the study make any mention of the starting health status of study participants?
That's an excellent question. So they did look at various groups. So they looked at people who are obese and other comorbidities. They don't can't think of it right off the top of my head. And they said that there was reasonable evidence of efficacy even amongst those groups. So even amongst obese and elderly and some other comorbidities, there seems to be some level of reasonable efficacy within the parameters that we talked about in the presentation. And how about severely immune compromised people? Well, I put up a slide there where in some research summary, they say that they need more data on immunocompromised people. So really the authors of the study, they admit that they need more study on that group.
Thank you. We have a question, Dr. Marcoux, I'm gonna ask this one to you. How long should we take the 1,000 units of vitamin D or 10,000?
Oh, yeah. So, well, it depends on your levels. Like if after you've taken 10,000 units a day for 6 weeks, you get a blood test and you're still low normal, that means you have to go even higher. Now, if you're in the mid-range or the high range of normal, then you would stay on 10,000. I mean, it depends on your color, but at least 10,000 through the winter, or if you have any health, they're not going to stop this virus. I mean, is evidence that it can travel much farther than six meters or 6 feet, and it's coming to a community near you, and eventually all of us are going to get exposed to it. So how long you would want to stay on it is how long I would stay on it for good. I mean, in the summer you may need less because of the sun, 5,000 units, but I mean, you know, I would recommend staying on it long term. Because if it's not this virus, there's another one, and it could be even worse. So again, our innate immune systems really need to be helped, and that's why we're emphasizing our hygienic living, as the health reformer said in 1870s.
Yes, thank you, Dr. Marcoux. Question about the study: do we know what was used for the placebo?
Saline.
Saline. Okay, so we've got a couple.
I believe it was saline. Yeah.
Saline. All right. Got a couple questions on that. Thank you. We are coming down to the last few minutes here, so we'll just take the last few questions. Questions: has it been a third-party study, and has the study been replicated? Probably too early, right, for that?
Yeah, I don't think they did third-party or replication studies. No. I don't think they did that.
Yes. Okay.
I don't know, but I don't think they did.
Yeah. Okay. Did they check for cultural differences, ethnic cultural differences? Do we know the makeup of the study groups?
They did. That's an excellent question. So the makeup of the study is actually very similar to the makeup in the United States. So they looked at whites, blacks. Let's see here. Yeah. So whites, blacks, and African American, Asian, Native American, Native Hawaiian, Pacific Islander, multiracial, then Hispanic. And I believe that they report generally reasonable efficacy amongst those groups. Yeah. So yeah, it was not just whites or blacks, or it was a wide range and kind of distributed similar to the American population.
Okay. Excellent. All right. I think that's pretty much it.
There was one question I saw in the chat which I would like to address. The question was, can you not overdose on vitamin D? And I would like to address that. It is very, very rare to overdose on vitamin D. There have been studies recommending that in certain populations that you would recommend to take 1,000 units per pound per day. That's 2,000 units per kilo per day, we'll say. So I am 140 pounds. So technically, they're saying that I can take 140,000 units of vitamin D per day and not worry about overdosing. There was one situation that Dr. Youngberg did discuss, that a man did come in with vitamin D toxicity, but he was taking in the millions of units per day. So yeah, I don't think we have to fear. Certainly not. I would not blink an eye for a second to not take 50,000 units for 3 days if I were to contract COVID. No question, no problem.
Okay. So I just want to, we're closing off here. I just want to ask a fun question here. So Dr. Marcoux, Dr. Cho, would you take the vaccine yourselves?
So I am choosing not to answer that question, Daniel. And the reason is because I in no way want to influence anybody against taking it or to take it. And so I'm going to decline that question answering.
Sure. Okay. Dr. Cho?
For me, I'm definitely waiting. So
you're waiting. Okay.
Like if I was available today, it's not like I'll go tomorrow and get my family vaccinated. So
Mhm.
I'm not fully against vaccines, but I'm not going to rush to get one either, because I do want to make sure that it is kind of at least be more comfortable with the process, you know.
Yes,
So for me, my answer is I'm waiting.
you're waiting. Okay.
How long I'm going to wait, I don't know, but I'm waiting. So
And one last point, if I could just throw it in.
Sure.
It's been proven that if you trust your therapy, it's going to benefit you. But even if you have a good therapy and you really think it's going to hurt you, the psychological effect is most likely it will hurt you. So you know, I certainly wouldn't encourage you to do something against your personal convictions and conscience. Either way.
Okay. Great. Thank you so much. So that brings us to the end of our time. Just want to thank everyone for joining us. We know that many people tried to get in but couldn't. So this session has been recorded and we're going to post it online. So if you have friends or family who you think this session would be valuable, we encourage you to share it. We will send an email to all the registrants. So we just want to thank everyone. We hope that we shared a little bit about the study and shared a balanced perspective. And I really want to thank Dr. Cho and Dr. Marku for sharing this with us. I want to thank everyone for the questions, and perhaps as COVID keeps going on, we will do more sessions about the vaccine and about COVID and related matters. So please do sign up online for e-updates from Lifestyles Medicine Institute. Just go on our website. I'll post it on the chat box, and you will stay updated on future sessions. So thank you so much again. May God bless you, be with you. Please stay healthy.